Greetings and welcome to Aetna Insights for Producers and Consultants webinar series. During the presentation, all participants will be in a listen-only mode. Please keep in mind that we'll be discussing confidential information intended only for invited producers and consultants. If you are not an invited producer or consultant, you must immediately disconnect from this call. In order to participate in this webinar, you acknowledge and agree that you will maintain the confidentiality of any Aetna information disclosed and will not make use of or disclose such information to anyone without the prior written consent of Aetna. I would now like to turn the call over to Elizabeth Sanford, Vice President, Strategic Partnerships, Aetna. Elizabeth, please go ahead.
Thank you for joining our August webinar. Each month we sit down and we have a conversation and discuss topics that demonstrate Aetna's value pillars of being caring, connected, and closer to home. I'm really excited for this month's discussion. It's focused on Meritain, Aetna's third-party administrator solution that currently serves about 1.5 million members nationally. Meritain is a tremendous asset in our portfolio, and its customizable platform provides plan sponsors flexibility to tailor solutions to optimize member outcomes and costs. Joining me today for our discussion is our Meritain expert, Michael Ciarrocchi. Michael is the Chief Market Development Officer for Meritain, and in his role, he is responsible for developing and executing Meritain's local market growth, business development, and product strategies. I've also invited Christina Rassi from the Aetna sales organization to add some color commentary and show how this really works in a day-to-day scenario. So from a sales perspective, Christina will be adding into the discussion and talking about how this works with our producers and consultants in our local markets. Christina is the market head of sales and service for Texas, and in her role, she's responsible for driving growth and retention within her market. I've got a few questions to get us started and guide the discussion, but I know that this is really going to be much more of a dialogue. So if it's okay with you both, I'm going to just dive right in. So Michael, the first one is really just a level-setting question for our audience. What is Meritain and the Aetna CVS Health portfolio?
Thanks, Liz, and also thanks very much for inviting me here today to chat a little bit. I'm thrilled to talk with you and Christina and our producers a little bit more. So Meritain is a third-party administrator. It's an acquisition that goes back to actually to 2011. So it was created by aggregating a number of different third-party administrators before we acquired them on the Aetna side. And back at the point of the acquisition, as a TPA, it was about 400,000 members. And as you pointed out at the beginning, we're almost about 4 times that size. And at the point where we made the acquisition, our thought was that there is this segment of self-funded customers that really prefers the value proposition of a TPA. And we'll talk a little bit more about that today. But a lot of that has to do with the desire to have real control, to have a lot of customization built into the plan, to be hypersensitive on the needs of accessing that data, as well as working with many point solutions. And so what we've sort of learned since the very beginning, 10 years ago from that acquisition to what's happened now, our customers used to be fairly simple, but very had a lot of demand around that level of control and the customization. Fast forward, what we now find is that in addition to those customers, we find a whole new segment of the marketplace that is looking for hyper aggregation of point solutions, that's looking for, frankly, to partner with an organization that has a broad suite of solutions. And that's really what we have evolved into being. And that certainly has played into effect since our broader acquisition by CVS Health, because not only do we get to bring our Aetna assets to our customers, but we also are able to leverage some of the CVS ones as well. And so whether you're working directly with somebody on the Meritain team, or for instance, somebody like on Christina's team, you're really getting this really broad set of solutions that you have throughout the entire market. And Christina, I know you've seen a lot of opportunities in Texas as well for those on your team who are trying to help producers solve really complex problems.
Yeah, you bet, Michael. And thank you, Liz, for allowing me to join you guys in this vibrant and colorful conversation on what I would consider an evolution and change since the time Aetna brought in Meritain, and since then with CVS as kind of the powerhouse behind both entities. We have seen that evolution where we have a lot of customers that ask for creative solutions that Meritain's able to provide with the strength of Aetna behind it.
What's been great now too is that producers have that opportunity, so they can really get the best of all worlds when they're working with our teams. They have the opportunity to get that fully integrated Aetna model, but they also have the opportunity to leverage the aggregated model that Meritain is able to provide. So really providing the broadest set of not just product solutions, but also subject matter experts in order to be able to solve those problems.
So you touched on this a bit, Mike, but maybe you could expand on how do producers and consultants, how should they think about working with Meritain and Aetna together? Like, what's the best way for them to do that?
Well, I think the best thing about that, Liz, is that whatever that best way is really to kind of meet our consultants or our brokers wherever they are. So in some cases, there are some markets where there's a Meritain salesperson that has been in that market for a couple dozen years in cases. And so there are some producers that we work with that have been working with Meritain well before the acquisition. And so if that relationship is the one that is their preferred method of sort of working with the TPA, you know what that looks like, then by all means continue leveraging that relationship. But on the other hand, if you have worked and are more comfortable at using the Aetna local market, or if you've never partnered with us on the Meritain side, probably the easiest path forward for our consultants is going to be to work with your Aetna local market office. The great thing is that in that situation, you don't have to worry about navigating to the right spot, because as happens, for instance, in Texas, when a Dallas-based broker is not really sure what is going to be the best solution, maybe he's never worked on the Meritain side, they can talk directly to somebody on Christina's team in that local market, and together they're going to reach out. They're going to pull in the subject matter expertise from the Meritain side, and then together try and strategize about which might be the best solution for their particular customer or their particular marketing strategy.
You know, and I would add to that you know,
really
for us,
no, go ahead, Christina. I was only going to say that there's really no wrong point of entry, right? You can go either way.
There's absolutely no wrong point of entry for us. I mean, it is one team, one mission. We are here to service your needs as well as your customers' needs. So to Michael's point, whichever is that normal path in which you would reach out to ask for kind of support. Our goal really is to be a resource not only for opportunities, but also when you run across those really tough problems that you need help creating solutions. So I'd say reach out to your local Aetna person or through the Meritain rep, and either way we'll work with you to figure out what the best solution is.
And Christina, you make a really good point that I was just thinking about when we were talking, and that it's not just at the point of the sale, right? So it's not just through navigating through the onboarding process and through the sales process. But for instance, if a broker has a really large block of Aetna business and has just a handful of cases on the Meritain side, right? It's not like your team says, well, sorry, we can't talk about anything on those Meritain cases. They still are able to keep your team intimately involved in that process. It's just that we've added additional Meritain account management and sales resources and reporting resources, et cetera, to be part of that team to help service your consultants in your market, right?
I mean, that's really the beauty of the relationship, right? Is that you've got two teams really helping make sure that not only we meet the needs of what you're looking for in the beginning, but throughout the process. Once you move to Meritain, you still have both entities there to support you throughout the year. So you've got, I mean, two teams focused on really what your customer needs.
So, Mike, you talked a little bit about kind of the history of TPAs. What are some of the misperceptions about TPAs? And can you set the record straight for us today?
Sure. Yeah, absolutely. And look, some of them are kind of funny, right? If you think about sort of the history of the TPA space, right? A lot of them sort of evolved from quite literally mom and pop organizations, niche or cottage industries sprouted up where there were some TPAs even that were built to serve just one customer or maybe just a handful of customers in a small local market. But the reality is that that space has really changed pretty dramatically. And so those perceptions, right, of, well, you know, claims, they're paid out of some warehouse or some garage. Well, that's certainly, at least in the Meritain space, is not true, right? There's 1,800 people who are fully dedicated to serving all of that TPA membership. I think there's also a perception that the TPA solution could be really unsophisticated, right? It's just a low cost or just a cheap version of what you could get through a carrier. And so while, don't get me wrong, there's certainly some efficiencies that we can demonstrate from a cost perspective. The reality is that what we've been able to maintain was a level of that flexibility so that actually a lot of the solutions end up being awfully sophisticated. Especially when you start integrating things like a navigation firm or some other type of point solution. I think that being said, there's some really beautiful things about that TPA legacy and that DNA that comes with it. It's part of the reason why we've been so adamant at Aetna about making sure that Meritain, that TPA DNA, we don't lose it. And so there's a level of hustle, there's a level of being nimble, and there's a level of trying to figure out new point solutions that our customers bring to us that we really like to embrace. And that legacy of our TPA heritage is absolutely something that we are utterly committed to. So no, you don't have to worry about claims being paid out of the back of your trunk, but at the same time, you also feel a level of comfort that the DNA that we have that comes from being a TPA is absolutely something that we embrace and combine it with all the great aspects of the Aetna and CVS Health culture that we have working with Christina and her team and others throughout the country.
That's pretty helpful. So when you think about then Meritain as a TPA, right, and how do we differ from others?
Yeah. So let me sort of break it down in terms of a couple different ways of looking at that space. So if you're talking about sort of the independent TPA, one of the things that we had that we were able to leverage was clearly the assets from Aetna that help us around total cost of care. Network obviously being primarily one of them, but also some of the different joint ventures and value-based approaches that Aetna takes when it comes to improving the member health while reducing total cost of care. Now, fast forward to today, when not only are we able to harness those Aetna assets, but we're able to bring in some of the assets of CVS Health, so some of those products and some of those solutions. So today we're able to not just offer minute clinics and health hubs as part of our network, but we're able to integrate them in what we call the low cost or no cost plan designs, where a Meritain member, for customers for whom this works, a Meritain member, when they place their ID card down at a minute clinic, because that's the best place for them to access care in that moment, they're going to be able to get access to that low cost or that no cost copayment by being part of that for customers who find value there. So I think that's one of the things that's particularly unique about Meritain is some of those assets that we bring. But then when you think about the way that some of the other carrier-owned TPAs operate, there's a couple things for us that we think are particularly different. The first one is as I mentioned before, that TPA DNA is something that we honor, we embrace it, and we enhance it. So we are always going to be able to leverage the really amazing assets and distribution team on the Aetna side, where frequently they have really great, strong local and deep local market relationships. But then the other thing that we're going to be able to do is we're going to do some things that maybe a lot of TPAs have sort of forgotten about. Sometimes a TPA will really focus on high auto adjudication rates. Well, what we're focused on is making sure that we are eyeing claims at, frankly, a very low dollar threshold to make sure that the clinical appropriateness and the contractual obligations are being met. And that's something that a lot of TPAs have sort of forgotten how to do. But then the other thing that we're going to do is we have, because of our extensive history, in particular with some of these point solutions, we've built dedicated units that just integrate with them. And a lot of times a TPA will say, well, yeah, we work with that point solution or we work with that navigation firm. But without having the kind of breadth of experience, it's hard to be able to give a consultant a 360 view of how that particular customer's plan is performing. So what we're going to do is be really intentional about coordinating with those point solutions, whether we're providing data to them or aggregating data from others. We are going to help our brokers really see from end to end the overall plan performance. And frankly, that's something that we've been really intentional about and something that really separates us from the competition. So
I know that you guys have both sold business together, and you've got lots of examples, I'm sure, Mike, on success stories that you've had with Meritain and Aetna. Can you guys share some of those just to bring this to life? Because this information is really valuable to our audience.
So I love calls from Christina, because they are almost always, hey, I got a situation, or we've got a case, or we've had this broker with a really creative idea, and we think, we're not sure whether or not what the best approach would be. Can we strategize together? So a lot of the conversations that Christina and I and Christina's colleagues throughout the country end up having are usually start with, well, what if, or we've got a situation or something like that. And so sometimes it's been a hospital, right? A hospital who wanted 5 tiers. Right. And there are some who do, in fact, want that. A lot of times it's for a customer who wants to maybe take on a broader role. Hospital, again, would be a good example of this, that are looking to do something a little bit unique in the marketplace, and they want to maybe do a few more things, whether it's do more medical management, or they may want to try some unique styles of incentives around wellness. And we're really good at helping to sort of figure out whether or not that might be a good solution and a good partner. We've seen a lot of growth, especially even now. We just recently in Texas started to expand even in the public and labor space, where that has been particularly meaningful. But what I love, like I said, what I love about those kinds of conversations is they usually start with a producer or consultant who has one of those what if ideas. And Christina, I know we've sat on phone calls and webinars for quite a bit trying to navigate through some of those different types of solutions.
And those are the best ones to receive, right? I love working with our channel partners and finding solutions to meet those needs, because the challenges are real, and the environment is creating far more requirements on an employer to not only manage and control costs, but also to make sure that they're delivering that care down to their members. So, to Michael's point, a recent example, at least for us in Texas, is, we had a customer that was with a competitor that was completely dissatisfied with their domestic steerage and their claims adjudication. To Michael's point, we're far more nimble and we're far more able to make the changes necessary to kind of address those needs through Meritain. So really our value prop in that whole conversation was just developing a sustainable tiering strategy where it was focused on driving domestic utilization and administering out-of-network claims. It was under a 5-tier network, to his point, which those are super complex and have a lot of moving pieces and components. They were looking at custom networks. They wanted the provider list white labeled. They wanted the advocacy and navigator aspect of it. So, those were things that we were able to provide them through Meritain that they weren't able to receive from their current carrier.
You know what else I remember about that case too, as we were strategizing about it, is I think it's a really good example of, I think the customer wasn't entirely sure exactly ultimately where they were going to be in, say, 2 to 3 years from the perspective of medical management. They knew that they wanted to play a deeper role in it, but weren't exactly sure about how to navigate to that path. And what we were able to do was concoct a solution together by doing a really good job of listening, getting some really good insight from the consultant that helped us figure out sort of how to journey with them on that path. So what we've got a strategy in place to do is to dial up, or maybe in some cases dial back their level of involvement in some of those types of clinical models. And so what that does is that allows us to sort of walk with them on that journey, and again, maximize the level of control and flexibility that they have. Again, all the while not sacrificing all the assets that we have through Aetna and CVS, and on the Meritain side, through some of our payment integrity strategies that help us improve their total cost of care.
All right. So you both have shared a lot of information, and we've covered a lot of ground in a short amount of time. So for this audience of producers and consultants, what are the 2, 3, 4 main points that you want to leave them with? What do you want them to take away from this, Mike?
Sure. I think the first thing is that Aetna, whether it's through our integrated solution on the Aetna side or the TPA solution on the Meritain side, we're able to really offer the broadest set of solutions that's going to meet that customer where they are, and we're going to be able to journey with them along that path. But the second thing that I think that's important to remember is it's okay if whether you come at it from the perspective of, hey, look, Meritain, we know exactly what we want to do. We want this navigation firm. We want this advocacy vendor. We want this stop loss player. We want this from a pharmacy solutions perspective. Absolutely, that's a great solution. We can sit down and strategize with you as well. On the other hand, if you're more at that perspective of, gosh, I know this is a really unique customer that's got some really unique needs, and honestly, I don't know how to solve them. That's okay, because we integrate with over 200 different point solutions. We use 60 different networks. The reality is most of our customers are with Aetna, because that's usually what works. We work with about a dozen different preferred stop loss vendors, while also being able to offer the Aetna stop loss as well. We're going to be able to help you sort of see that entire world, make some recommendations about what we think would probably have the most value, and then at the end of the day, let you guide us in terms of what that right solution is. So wherever you are on the spectrum, from I know exactly what I want to do to I have no idea what I want to do, we're able to kind of meet you and leverage those different solutions, no matter where you are or your customer is on that journey.
Okay. And any other last words that we want our audience to remember about Meritain, or working together with us and Aetna?
You know, for me, I think in closing, we understand that, one size doesn't necessarily fit all solutions. And, I fully support the value prop that Michael had discussed around really coming to us to either ask if we can accommodate or explore what those solutions may be.
Yeah, one thing I'd close with is sometimes I feel like what that billboard, right? Watch this space for what's next. When I think about I've been at Aetna now for over 20 years. I've been at Meritain ever since the acquisition, and I don't ever recall a time when I was more excited about what's next. Yes, part of that is just the tremendous growth in terms of self-funding. Yes, part of that is sort of the transformational nature of some of the recent regulations around transparency and coverage and those types of things, which we're gearing up to not just support, but to try and embrace for our customers and their producers. But the things that are in the works in the lab, not just at Meritain, not just at Aetna, but also at CVS, our ability to be able to bring those front and center in a way that other TPAs can't, that's pretty exciting. And so I love seeing what we're doing with them in the broader CVS and certainly on the Aetna platforms, but the uniqueness from a TPA perspective that we'll be able to apply them in a space that frankly has often forgotten how to use some of those assets to improve total cost of care. I couldn't be more excited about what's next. So the thing I'd leave you with is keep watching because we're going to continue this growth and continue to support that by some of the really cool products and services and solutions that we're going to be able to partner up with Aetna and CVS on as well.
That was great. And I agree. There's a lot going on and there's a lot to be really excited. So I like the watch this space piece. So thank you both for your time. Our next webinar is going to be September the 16th. It's at 12:30, and it is going to be a conversation. It's a good continuation. It's the conversation on Aetna connected products and how we are providing local access to our members across all segments. So we look forward to seeing you then. Until then, please enjoy the rest of your summer and stay safe. Thank you.